Dr. Bukowski's Backyard Back Clinic again. I'd like to talk today about the concept of disc replacement. Why do I want to talk about disc replacement? Most people that are candidates for disc replacement today are cervical disc replacement. That is the cervical spine and neck. There are disc replacements for the lumbar spine. They were developed earlier than the cervical ones, but they have lost flavor because of questionable outcomes. Now, why does someone need a disc replacement? Not everyone with a herniated disc in their lumbar spine or in their neck is a candidate for a disc replacement. Sometimes we can just take a piece of the disc out. Sometimes we can do a fusion of the neck. Why pick a disc replacement? A disc replacement is the optimal treatment in a young person with one herniated disc in their neck. Why do we do this treatment? Because the typical surgery of a fusion for a neck disc herniation is called an anterior cervical discectomy and fusion. This procedure is a great procedure. It relieves 99% of people's pain, and it's got a 99% success ratio. So why do we want to change this 99% success ratio? Because the fact is, in 5 to 10 years, this 99% success ratio leads to the next level wearing out. When we fuse the spine with this ACDF, it causes a rigid segment. Energy is not lost. That's the first rule of physics. When we bend our neck, energy is involved. Energy is the same if I have a fused neck or not. So that energy is transferred to the good discs, and the good discs in a fused neck wear out twice as fast. And at 5 years, there's a 20 to 40% revision rate of people that has an ACDF. So researchers began to recognize this and they started to develop artificial discs. Artificial discs are a misnomer because the discs that are currently out there are embedded into the bone, unlike a normal disc. They do not provide compression or resilience as a normal disc. They do provide mobility. And the initial research of these artificial discs are showing that the patients are getting a better outcome in terms of they go to work faster, they have less intraoperative complications, and the initial studies are showing that there's less adjacent level disease. So this artificial disc is mainly a motion preservation device designed to, one, relieve the neural compression like an anterior cervical discectomy does, and preserve the motion to avoid the adjacent level from wearing out. I am sold on this device. I am so sold on this device, let me tell you. 6 months ago, I had 2 artificial discs placed in my neck. I was back to work in 10 days. I'm back to kite surfing, fishing, and surfing myself. I'm sold.